All right, welcome to the deep dive. Today we're going to be taking a deep dive into secondary metabolites.
It's exciting.
Yeah, and I think a lot of our listeners are probably familiar with secondary metabolites.
Yeah, familiar with the term, at
Yeah,
least.
exactly, and familiar with the term, but maybe not with all the incredible medicinal uses that they have.
Right.
So we've got a ton of sources here, articles, notes, all sorts of stuff.
A lot to dig into.
Yeah, so we're going to try to figure out just uh, how important these things really are for us and for medicine, both modern and traditional.
Yeah, and I think it's helpful to think of secondary metabolites as primary metabolism is what keeps the organism
So keep
alive,
the lights on, yeah.
keeps the lights on. And secondary metabolism is like all of the bells and whistles, that allow it to interact with its environment.
Right, right. So it's not strictly necessary for survival, but it gives it that extra edge.
Exactly. And some of those bells and whistles we have as humans have found very useful.
Absolutely. So let's jump into the pharmaceutical applications first.
Sounds good.
It's really, really amazing when you look at all of the modern medicines, how many of them actually have their roots in secondary metabolites.
Mhm.
So they're either directly using the metabolite itself or something very, very similar, or they're using it as a starting point for, creating even better drugs.
Right. And what I find fascinating is the range of conditions that they treat.
Yeah, absolutely.
So, if we start with something like pain management, you have morphine, which is an alkaloid.
Right.
And so alkaloids are these nitrogen-containing compounds that are found in plants. And morphine is a really powerful painkiller because it binds to specific receptors in the brain.
So it's really effective for treating those really serious pain conditions.
Exactly. And then if you look at something like malaria, which is still a huge problem around the world,
Right.
we have quinine, which is another alkaloid that's been used to treat malaria for centuries.
Hmm.
And then more recently, artemisinin, which is a terpene, and terpenes are often characterized by their multiple isoprene units,
Yeah.
has been a really key drug in fighting malaria.
Wow, so many different classes of compounds
Yeah.
being used to fight all sorts of diseases.
And absolutely. And if you look at cancer,
Right.
which is another major health issue we have, vincristine is an alkaloid that's used to treat a variety of cancers.
Mm-hmm.
Paclitaxel or Taxol is a terpene, and that's a really important chemotherapy drug.
Okay.
And then doxorubicin is a polyketide, and these are larger molecules, often built from repeating smaller units. And that's also a very important chemotherapy drug.
It's amazing. It really is amazing how nature has provided us with so many of these sort of base level medicines, right?
Yeah, like the first draft.
Yeah, the first draft of these really essential treatments.
Right, right, and even antibiotics like penicillin, which is actually a derivative of a polyketide, uh, erythromycin, tetracyclines, all of those are either polyketides or derived from them.
And they've completely transformed how we deal with bacterial infections.
It's incredible, and if you think about it, it's really just a testament to the immense chemical diversity that exists in nature.
Right.
So even for heart health,
Yeah.
you have digoxin,
Mhm.
which is a cardiac glycoside. And a glycoside is a molecule that has a sugar attached to it.
Interesting. Okay.
And digoxin is a really important drug for treating heart failure.
So it's not just like one particular class of compounds that's important. It's all sorts of different
Sure.
molecules and they have different mechanisms of action, but they're all they all can be traced back to these secondary metabolites in some way.
Exactly. And for inflammation, you have salicylic acid derivatives, which is the basis of aspirin,
Oh, okay.
and then curcumin, which comes from turmeric. And those are both showcase the power of phenolic compounds, which are molecules that contain an aromatic ring with hydroxyl groups.
And the list just goes on and on and on.
It does.
So you've got immunosuppressants like cyclosporine, which is a cyclic peptide,
Right.
and rapamycin, which is a polyketide.
I?
Cholesterol-lowering statins, which are also polyketides.
Yeah.
Even galantamine, which is an alkaloid that's used for Alzheimer's.
Wow.
All of these have roots in secondary metabolites.
That's incredible.
And menthol that we use for as a cooling agent, a topical analgesic,
Yeah.
that's a terpene, and warfarin, which is an anticoagulant,
I like
is
that.
derived from coumarin, which is a phenolic compound.
It's amazing to see how much we rely on these natural sources.
It truly
for
is.
our well-being.
It's amazing. And so now let's shift gears a little bit and talk about traditional medicine, because it's not just modern medicine that's been using these compounds. For centuries, people have been using plants to treat all sorts of ailments, and a lot of these plants are rich in these very same compounds.
Exactly. And different cultures have, through observation and experience, uh, have found ways to use these plants effectively.
Right, absolutely. So, for example, herbal remedies that are used to boost immunity,
Right.
like echinacea.
Yeah.
That's a classic example.
Yeah. And then you have Ayurvedic medicine, which is a traditional system of medicine from India.
Right.
And they use holy basil for respiratory issues and for stress.
And that's all thanks to the unique blend of secondary metabolites in that plant.
Exactly. And in Chinese medicine, you have ginseng and ginkgo biloba,
Oh, yeah.
which are valued for their adaptogenic and cognitive enhancing properties. And again, it all comes down to the unique profile of secondary metabolites in these plants.
It's really a testament to the effectiveness of traditional knowledge, that people were able to figure out which plants were useful for which conditions without even knowing about the specific compounds.
Exactly.
And, beyond just direct medicinal use, it's worth noting that these compounds are everywhere.
They really are.
We've got limon in food flavoring.
Right.
Anthocyanins are used for color, essential oils as preservatives and fragrances.
Right.
Squalene is used in cosmetics. Even natural pesticides in agriculture all come from secondary metabolites.
It's remarkable.
And then in nutraceuticals, you have compounds like flavonoids and lignans that offer antioxidant benefits.
It's clear that secondary metabolites are just everywhere.
Yeah, they really are. So what's the big takeaway here for our listeners?
Well, I think the big takeaway is that secondary metabolites, with their incredibly diverse biological activities, are just invaluable resources.
Yeah.
And they represent this really powerful link between the wisdom of traditional practices and the precision of modern pharmaceutical science.
It's a really beautiful marriage of those two worlds. So we've been through a lot of your sources, and I think it's pretty clear that secondary metabolites are this gold mine of compounds with just an amazing range of medicinal uses.
And they span millennia and scientific disciplines.
And so that leaves you, our listeners, with this really compelling thought. How might our understanding and application of these compounds evolve in the future?
Yeah, how can we better integrate traditional knowledge with modern scientific tools to unlock even more of nature's therapeutic secrets?
That's a great question, and thanks for joining us on the Deep Dive.
It was a pleasure being here.
You'll see you next time.
See you later.
Bye.